meeting. So we plan on having webinars like this one every single Saturday. So be sure to check your emails and the WhatsApp group regularly for more information. Our goal at Career Talk 360 is to have different speakers explain their careers every week so that you guys can explore many different career options. We hope that by the time you're done with high school, you have experienced basically every career and know which one best suits your interests. I hope to help as many students as possible, but I cannot reach every single student. So I would appreciate it if you could share the link of our website and your own experience with your friends and family. With that being said, let's get started. Today, as you know, Dr. VijayaShree Chintala will be speaking about her job as an internal medicine physician. She will talk about her work environment, educational experience, and more. I'll give everyone the opportunity to ask her questions in between. So if you have any questions, you can click the raise hand button and I'll unmute you when possible. Now, Dr. Vijaya, can you please introduce yourself and then I'll ask a few questions.
Yeah, hi. Good afternoon, everybody. I'm very happy that Nikhil Saigal has been started this program of Career 360, where the kids can really get benefited, like especially kids like who do not have like clear-cut idea like what they want to do in their career. So thank you very much. And then during this COVID times also, we're able to connect with the people and this through the video conference.
Thank you for that. So my first question is, what do you do on a daily basis at your job?
I'm an internist, which means internal medicine residency I have done. And then I see kids from around the age of 16 to like 99, 100, whatever the age. I am an internist, which is a hospitalist, which I take care of patients in a hospital environment, where once the patient gets admitted to the hospital, from that standpoint, checking the labs for the patient and arranging and talking with the family, communicating and like consulting the physicians, other physicians. For example, like somebody comes with a GI bleed or stomach bleed, then we consult the stomach doctor, or if they have any kidney problem, then we consult the kidney doctor, like coordinate all the care. And then not only that, when patients are being discharged from hospital, then again, we communicate with some people, like if they have a stroke or like if they have a heart attack and they are not able to walk. So what is the next point of care? We communicate all of that, coordinate, and then go from there. That's the everyday thing.
So you mentioned you connect everybody to different doctors and you check up on them. And you also mentioned internal medicine. So what does internal medicine really mean?
Internal medicine is like when a doctor takes care of a patient for if they have a cardiac problem, like renal problem, or like any of the problems. Like for example, if you take a cardiologist, like cardiologist only takes care of the heart and the blood vascular system, and the neurologist takes care of the neurology or the nerves part. But internal medicine doctor as a basic guy, or you can say that the team player, where admits everybody or takes care of everyone, involves everybody else in the care, and then see how it goes from there.
Okay, so you said you see many patients regularly. Do you work from home or only?
I used to be a hospitalist, in Arlington Memorial Hospital, where I used to work only in the hospitals. But recently, in the last couple of years, I have opened my clinic, seeing outpatients, like both ladies and guys, and taking care of general care, women's health, all the chronic medical problems. So as an outpatient doctor, I go to the office and see my patients regularly, and depending on what they need, like we'll check their labs, and then whatever tests are needed, we check for those and see how it goes.
So do you ever work from home because of this current virus situation, or are you still working?
Yes, I'm still working. Like initially, like when the COVID started, where we are not able to see the patients, we were able to do telemedicine, or telehealth it is called, where you talk to the patients on Zoom call or like some video calling. And then you talk to the patients, get the symptoms, like what symptoms they have and what problems they are having. And then you treat them. For example, you cannot examine the patient per se, or vitals. Sometimes some patients are able to take their vitals like blood pressure, temperature, and some of the ones. And some people have oxygen saturation meter, oximeter too. And they'll tell us about those, and then depending on what they need, like either upper respiratory symptoms or like stomach pain or something, and then we prescribe the medications. And sometimes they may need some of the labs also. So we write for the labs. So the patient goes, checks the labs, and then depending on that, we are able to treat. But since recently, again, some of the COVID thing has been relaxed, I have been started seeing patients in my clinic, but we are able to still wear complete personal protection equipment and then able to see the patients.
So you said that you used to work at the hospital and now you have your own clinic. So to do all this, what degrees did you need to get and what education experience?
Yeah, I'll come to that when I was really inspired. Like there are 3 members in my family who were doctors. One was my uncle, my dad's younger brother, and my cousin and my eldest brother too. Like from young age, I was very inspired by Swami Vivekananda. I am from Indian origin, so some of you must have known like Swami Vivekananda, and I used to read very much about also Ramakrishna Paramahamsa, and then I was into that kind of mood. And then later on, so the inspiration was my cousins and my uncle. And not only that, when they were able to motivate me and then said that this is the noble profession. I'm not saying that none of the other professions are noble, but depending on my personality, they kind of guided me and how to read, like how to like gear towards the medical side. Because in India, like in the US, it is a little bit different. In India, like in 11th and 12th grades, you completely take the biology side, like biology major subjects you take, and then whatever is required for the pre-med school, everything is finished, completed by those 2 years. And then after that, just like how you take the MCAT here, we used to take MCET. One is the entrance exam called MCET. So we took that one, and then I did my medical school in India, Hyderabad, India. And not only that, I had my inspiration, and second one, the motivation. Yes, I want to do this one only, nothing else. That one, and then next was compassion. The compassion is like, okay, not only like some people say, okay, doctors, they make a lot of money or whatever it is, but we need to have this compassion. Like for example, in this COVID conditions also, like you are aware that when you go to the hospital and see these patients, even though I or other doctors wear this PPE very regularly, religiously and all that, still there is a high risk of getting the COVID. And then some people have passed away too from this one, but still the compassion is there. Like, okay, I want to go and make a difference in the patient's life. Sometimes like you are not appreciated a lot. Sometimes like patients' families ask a lot of questions. Don't get that to the heart. That's what I used to say, in my cousin and my brother used to say, don't let that make you down. So the compassion, like where, okay, separated that one, and that even like one person appreciates you. I carried that one with me, and then every morning when I wake up, I said, okay, because of that, I'm going to do this my job. So it's difficult. Like sometimes with these pandemics or epidemics, it's really hard. And then sometimes in the influenza season also, it's hard. But unless you have that compassion, it doesn't come naturally at an young age of like you are 14, 16, 18, like that. Slowly you cultivate it, and then you keep it up with you. And the next one is it's perspiration, which is hard work. Yes, you have inspiration, you have motivation and all that, unless you really do that hard work. Because just getting your foot into the medical school is not just the beginning of it. It's like you have to work really hard religiously, and not only that one, and focus. Like there are so many things like to do in there also. Like people get diverted, and then okay, I'll do this one, I'll do that one. The focus, the attention should be really there. And not only that one, like I would also say one more aspect of me is like leadership qualities. So I was our class representative in the 3rd year, and I was also the college ladies representative. So I'm not saying that everybody should have something like that, but thing is, it gives you a big extra mile to walk around, that leadership, like at least taking yourself. You don't have to lead your class, or you don't have to lead the whole college or something. At least take yourself and carry yourself to the next mile, what is needed. So that's definitely, I think all of this like is needed in a child, like whoever is thinking like, okay, I'll go any profession, not only medical profession, any profession that you go, you need these qualities. And always remember, yes, and sometimes people are sick, they are not able to put the 100%. But whenever you can, remember these points, and then definitely you'll go to that extra mile.
So you said that you have to be determined and you have to know that you want to do this. So for you, what age were you when you decided that you wanted to pursue medical? And were you always like from a young, very young age, or did it take some middle school, high school, or when did you know that you wanted to become a doctor?
It was when I was in kind of like middle school, high school, actually, like 8th grade, 9th grade. That was the time. Before that, I was kind of like childish, like I had like childish thoughts. I used to read good and all that, but kind of like didn't have the goal, like, okay, I want to become this, I want to become that. So my family was telling me, my brother, my father were encouraging me to become a doctor, but I wanted to see like what other profession is there. So initially I wanted to become a lawyer, and then I wanted to become an engineer. And then so after some certain time, I went and volunteered in my uncle's clinic for some time. That's when like it's what really appealed to me was when I was like with some, I went to a summer vacation, and then for a couple of weeks I was with him, and then I saw like how compassionately whatever happens in the house or anything, it's like he used to able to cut off himself from that. And then when the patient comes, his whole focus is on the patient, how nicely he used to talk and how nicely he used to treat. It was completely a different experience. And then that inspired me, okay, this is the one, really one. And initially I started like working towards that.
So your uncle also had a clinic? Is that what you said?
Yes, he had like in India, they used to call a nursing home where he had like 10 beds, and then he used to see patients during the daytime. Yeah,
So is that what inspired you to start your own clinic right now?
clinic that it's a little bit different. After I finished my residency in, I'll come back to that one too, like how my journey happened from India to here. I was married, I came here, and I finished my, I was focused initially the first couple of years of was not that much focused. So I took it light, but later on I cleared my USMLE steps 1, step 2, and CK exams. And I also worked as a fellowship in like cardiology fellowship, like a resident, which is like under a very esteemed cardiologist. So that's when it gave me some more points. And then after that, I finished my residency, internal medicine residency in West Virginia, Charleston, West Virginia. And I took my first job there as a hospitalist, which is like taking care of inpatients. So I did that. And after, once my husband relocated to Dallas, Texas, I moved with him and worked as a hospitalist for 10 years. And then I was kind of like, sometimes you may call it a middle-age crisis, or it's like sometimes you want something different in the same thing. So then I decided, okay, let me do this, and I will open up my own clinic to see patients, and then see like, because I was always like that satisfaction, like when you sit with the patient and when you work in a hospital, you see different patients, but you will never get to see them back again or appreciate how you're doing. So in a more personal set, like in a clinic, like it's like just talking to some friends, able to take care of their problems, and then you see them back again and again, and then they appreciate you. So that kind of like caught me. So that's how I opened my clinic, but still I work as a hospitalist in the weekends too. So it's kind of like a combination. It may be hard later on, but I'm right now enjoying both the aspects of it right now.
Right. So you like to establish a connection with your customers and your patients. So that's what makes you really enjoy it, that you have a connection and they come back to you. So if I was to ask you about your job, what is your favorite part about this job that you have?
Because I have two, like as a hospitalist, sometimes there are like, which is a inpatient taking patients care of them. And sometimes you have really interesting, most of the time, like I would say like about 70% of the time, you do the routines like pneumonia or renal failure or stomach bleed or something. But sometimes you have like really interesting cases that you are challenged, like you need to work it up. Somebody comes with some pain and then belly pain, and then there is a mass, and then you're starting working up. And then you, as you involve the other consultants with your case, it makes you, okay, I did something in this person's life. So able to diagnose it and then show them the treatment, and then up to it, and then inspire the people like, okay, you need to take this medicine and then follow these routines and then go from there. So that's what is the one, sometimes it inspires you more. And the families are appreciative of that too.
And so you mentioned about that you used to work at an Arlington hospital and now you have your clinic, but you never mentioned where your clinic is located. So could you tell us where?
Yeah, my clinic is located in Las Colinas. It's called Valley Ranch area, actually, in beside the India Center, the Valley Ranch area. It is there. So beside the India Bazaar. Valley
So
Ranch
what's the
India
name
Center.
of your clinic?
It's Valley Ranch Internal Medicine.
Okay, okay. So before I ask more questions, I wanted to make sure if anyone else has any questions. So if you have any questions.
Yeah, let me finish up. I had like a little bit of more I want to talk to the kids, especially children. I admire, like, I know from a very young age, like you are taking this step to like which career you want to take, which side you want to go. It's like weigh the pros and cons of each subject or each profession. It's really hard. You are like around like 13 years or 15 years and you're deciding. It's a big job. It's not like, okay, first, like you think you will do something. Main thing is, number one, I would say goal. Set your goal, like, okay, you want to be a lawyer, you want to be a doctor, or you engineer or architect or anything, like, or interior designer or artist, something like that. So no job is small. And everybody, like, if world was full of doctors, it wouldn't work. If world was full of engineers, it wouldn't work. So we need all of the other people. And then it's not, no job is small unless you put your heart into it. So whatever your heart says, okay, this is one for me, go ahead with it, make a goal, that one, and research about it. So go online. Nowadays you have Google and whatnot, and research about it, put points like, how should I achieve it? Not only that, when meet like-minded people. For example, if you want to become an architect, okay, what am I supposed to do? So talk to other people with like-minded things and then put a goal. Sometimes during this time, someone may discourage you or say some negative points or something. Keep that in mind. Don't let it go your goal down or something. Like, keep it in mind. Okay, I should be aware of this. And then also keep your goal there positive. Always think about positive. Take all the positive points that everyone is advising you. And next one is chart out an nice like plan. Like, okay, what comes first, what comes next, what comes the last. So gather all the information and then also focus, like be focused. Okay, you do like one out of the 4 things or 6 things that you have, you do 2, and then don't be complacent. Okay, I have achieved some, and then go leave it like that. Try to achieve everything and then leave, and always think like, can I do something better than this? So that is one thing. And then, for example, you want to become a lawyer. If you go and work or do observership with a lawyer, get the recommendation letters, all the things. Like, for example, wherever you go and volunteer, always, like, it may be like something very small, but you don't know like how it's going to affect your career in the long run. So keep all the letters of recommendation with you, and then be religiously studying very hard, be focused, and finish your undergraduation, do MCAT or something, residency. And always remember, this is just the beginning. Once you get into med school, or once you get into residency, or once you first get a job, that is just still beginning, because you are a lifelong student. Always you keep honing your skills, and with new things, new techniques, new other things come up, you need to polish yourself every time. Otherwise you'll become obsolete, you'll be old. Okay, then somebody comes, they research, everything is available on Google these days, so they research something, newer techniques, and when they go and discuss with you and you are not able to tell that, then it's like they think, oh, she's not like up to date with the newer techniques. So that's why always be careful, like So that's what I would say, like, okay, never, don't think, okay, I'm done, I'm completely done, I'm in my first job, this is the end of it. No, always be a student, always keep on with your skills and everything, and then talk to some other people what new things are coming up, and encourage, and always have a positive attitude. That's what I would say. Like, there used to be a story like where the people say that, okay, in your heart there is a cup, always fill the cup with positiveness and positive attitude and something positive, so that when you wake up in the morning you look forward to something. And if somebody says something negative, just hear, let it go from the other ear, so that wouldn't should not be dragging you down. Okay, some people say, okay, doctors have long hours, they work weekends, they work nights. Yes, that's the down part, but it is like, once you know that you want to become a doctor or a physician, it is required. So later on in the life, if you have the ability, you can change your, like, a little bit of like how your working hours and all that, you can always change. So be like, and then be oriented with the family and be happy. Just don't be, okay, this is my goal, and get detached from your family and all that, because family is also very, very important. So it should be all integrated effect, not like one effect. So that's what I want to advise the kids right now.
So if you weren't, you were talking about how you should keep a balance and stuff. So if you weren't working in the medical field, do you have any idea where you would be, which field you would be working in right now?
I wanted to become an engineer. Like, initially I was like wanted to become like a mechanical engineer, but I researched for that part, and then later on I did not have an idea like what kind of job I wanted to do or what else I wanted to become. So that
So,
was the initial, but later on I shifted my thought process.
and before your current job as a hospitalist and the clinic, did you have any other previous jobs before those?
No,
Or
I don't have any. Like, after I finished my residency in the same West Virginia University, I was offered like a hospitalist job, so I took it at that time. And apart from this, career, I'm a mom. I have two kids. Who is like, one is a 14 years old girl and an 18 years old son. And my husband is there. I'm very much involved with that, and also involved in a little bit of spirituality. And I've practice this Hare Krishna, and I'm very happy because it's like, you need, because just work, 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 and then with the family, cooking, cleaning, not only that, something you miss that. So I'm equally blessed, I would say, by God's grace, equally blessed that I'm also involved with spirituality and very happy with all the things in my life.
so you said other than your job, you're involved with other things. Are there any hobbies you partake in regularly?
Regularly, it's kind of like hard, because like how our work hours are, like sometimes I work nights and then it disrupts like 1 or 2 days after that. So but still I do like crochet of something, and then a little bit of embroidery. Those are my main things. So, and I read a lot of books and watch television too.
Okay, okay. So, during this current COVID-19 pandemic, have you seen any patients that are suffering from corona?
Yes, like, especially not in the clinic that much, but when I admit to the patients to the hospital, in the hospital, I saw many patients for even from mild symptoms to like just like shortness of breath, fever, and that kind of symptoms, to like severe, who is intubated in the ICU, on the ventilator. So like it's seen different things. And then even in the starting of middle of March, we started seeing patients from corona positive, and then even now. And then not only that one, it changed a lot, like how we manage, because they have been doing continuous studies. And then initially how we were treating them, and then now how we treat it got evolved within the last, people might think, okay, it's been only 3 months, how did it evolve? Because how we different symptoms, we categorize them into like mild, moderate, severe, and again 3 categories in each of them. And all of them are treated differently, like about 3 months back, and now how they are treated there, it's all different.
So I have some more questions for you, but before I ask those questions, is there any other questions that anyone else has before I ask my question? If anyone has any questions, they can click the raise hand button in the settings, and then you'll be unmuted.
Okay, so I have a question. So when you first started your medical journey, what were the steps you had to take to like get to like opening your own medical clinic and like approximately how long did this whole journey take?
Okay, it's because I was graduated in India, which is I'm considered as a foreign medical graduate in the US. So in the US, like you finish your 12th grade high school, and then after that you do 4 years of undergraduation, and then after that you go into residency. But in India, like we do 11th and 12th grade as pre-med requirement. So, and then after that, medical school is like 5 years, and then you do internship 1 year. So 6 years after 12th grade, 6 years. It took me a couple of years, actually 3 years to finish my USMLEs. And then as an intern and a fellowship in cardiology, I was like assisting one of the research guys. So that 1 year, and then residency, I finished in internal medicine. I would say like after 12th grade, so that's 6 plus 3, 9 plus 3 is like 12 years. And then I did my job for like 10 years and then opened my clinic. But after finishing your residency, there is a choice. Some people like they go ahead and open their own clinic, but you are not that much experienced. So it's kind of like a learning curve, like initially, like, so it's a bigger learning curve. Now, since I have the experience, the learning curve is much smaller. So I hope I answered your question.
Okay, so is there anyone else that has any other question for her? Okay, so you were mentioning about how you've seen COVID patients before, when it first started and now. So has there been any other previous flus or influenza that have affected your job also?
Yeah, we used to have like flu season every year from November to almost March, beginning of March. Like that's like a 5 month period we used to see. So we used to advise, especially with chronic medical problems, if somebody has diabetes, high blood pressure, chronic kidney disease, hepatitis, or liver problems, all these people, they are more prone. So we advise them every year to take the flu shot. But not everybody takes, so you see a lot of the flus, but we were not just you wear a mask. If somebody has a flu, we used to just wear a mask and then you use your gloves. So that's one more thing I would advise is like if because of the COVID, kids, especially kids, because a lot of patients who are involved are not kids. Some kids are say, okay, kids cannot get in corona. So they take it easy. They don't wear the mask. They don't do the antibacterial gel. I would still advise everybody to wear your mask when you're outside and do not go and visit anybody who is sick, and then use the antibacterial gel and then practice like distancing. So those are the things. Yes, so we were a little bit involved with the flu season, but not as much as corona. Corona, you do completely like you're like almost like if you see the suit like you see the space suit, like how people in the NASA wear, it's almost like from head to toe you wear. But for flu, we used to just wear like a mask, the face mask and gloves. Those were the only two ones we used to do. But now it's completely different. It changed. Like even our we used to think that okay, nothing is going to change, like how we're going to practice, but it taught us new lessons too.
So you said that this has taught you new lessons. And so this before you said only wear mask and gloves, and now you have to wear more personal protection equipment. So did you have to receive any special training to treat?
No, no, we don't. Actually, what happens is every year, like we have like to do your job as a hospitalist, as taking care of inpatients, you have like, okay, for example, you have C. diff colitis. So you wear like a full gown and then gloves, but you don't wear like a face mask because that is contact one. So what happened with the corona is like it's like airborne plus, it's called airborne plus the contact precautions. So you wear the flu shot, like whatever the airborne plus contact and everything. So it's combined all three. Like for contact, we have a full gown and gloves. And then for flu airborne, we have just like a face mask and gloves. So it combined everything together.
So do you have any advice for kids that they can start right now to do right now? Any volunteering or anything that you suggest that they
Yeah,
do?
Definitely, I would suggest that number one is like go and volunteer your time. Like sometimes your school gives you some projects, okay, this one, do that one. And then they gives you some hours like working in the library or like some other things, following a doctor. If you have the ability to go and shadow a doctor in a clinic or sometime, go ahead and do that one. And then the next year, like when you, once you are in the high school or something, definitely go into a hospital setting. And then there is observership, so you will go, and then it's not only observership, it's like also like you see patient, not going and seeing patients history he's taking or something like that, but from the beginning of a hospital, like what happens is somebody, like you work at the information desk for like 1 week, for example. So you guide, like some people come and then you guide them, like they will show you, because beside you there will be one person like showing everything. So from the, if some visitors come or if when a patient comes, what happens in a hospital setting? So it starts from the information desk, like, okay, they will tell you to go to this one, get registered. And if they ask, somebody asks where some patient I'm going to go and see in fourth floor, you direct them how to go there. That is first point. Next point is you go and then give like magazines or something, and then little bit you sit beside a patient, but following all the same precautions. For example, if usually we do not allow visitors like who have contact precautions or airborne precautions if they have, because we don't want you to expose to that kind of a thing. So people, with normal people, you go and talk to them a little bit, and then also like you give them magazine, spend some time with them, and after that also like you'll be like following the doctors for 1 week, and then even in the cafeteria, like how the food is distributed. So it's like a program, like you have like 3-4 weeks. So I would definitely advise that one. And after that, like again, like if you're interested in internal medicine doctor, follow up with them, and a family practitioner or a surgeon or OBGYN who delivers the babies or does anything other care of women health care. So follow up with them, and then never try to shy away asking any questions, because it may be, you may think, okay, it could be a really silly question. No, it's just a foundation. Like even if it may feel like simple or petty or something, nothing is like that, because you are building from that. So I would say definitely ask questions and be studious, and then talk to them. If you have any questions, go ahead and ask. And if you ask the same question and then after 3 weeks you are going to ask the same question, it's fine. So that's what I would say.
So you, before you mentioned that you, when you were young and right now, you like to read a lot of books. So do you have any book recommendations that kids can read right now that can help them with their journey?
Yeah, that's what, like here, I did not grow up in here in the US. So it's kind of like what really inspired me is Ramakrishna Paramahamsa and Vivekananda Swami. And definitely I would, because at least for the Indian subcontinent people, I would definitely advise to read Bhagavad Gita, because it teaches you a lot of life lessons. And you may be really young and not able to understand, and then Gita is for everybody. Like if you are 14 years, your understanding is different. By the time you are 25, how you understand that is different, and by the time you're 40 or something, it's different. So that is one thing. And then anybody, anything, like try to read like something like which makes you understand what life is, what is our part, and how do we help ourselves. And then first we have to help ourselves, then we can help other people. So anything which is like, sometimes if you go online and ask like which are the books, then definitely it'll come up with an idea like, okay, these are the books to read. So
Okay. So yeah, and besides the basic skills you need for, besides the skills you need to be a doctor, do you have any other skills like speaking or anything else that people should practice that you encounter with hundreds of patients?
no, like actually what happens is initially like it's kind of like you are shy, like during the medical school first year, couple of years, you are basically like honing your skills of like biochemistry, anatomy, physiology, and all that. So you're not exposed to patients. But the time you come to third and fourth year, even the US or outside, you start like asking questions. Initially, like some people are timid, shy, not able to ask all questions. And then some, it's really hard to ask some personal questions, but slowly you get used to it, because you make mistakes, we learn. So that's the part of the training. So that like 3 years, 2 years or 3 years, you finish those. And then after that, when you finish the residency also, it's like 3 years. So 3 years constantly you're seeing patients, different questions you're asking. So you get that over with that shyness and all that, it's over. But I don't have that much skills. Like, for example, like we can go ahead, and then some people are really inspiring and motivational speakers. So I wouldn't say I'm one of them, but definitely I would, like, since this was the first opportunity, and I really thank you, Nikhil, and for this opportunity to talk to other kids and then answer their questions and all that. But it's nice like this. But I definitely don't have any experience. Like some people, like even like career, um, it's called impact lessons in India, where like some counselors or somebody, they come and talk to you and inspire you, and then they teach you the same thing, like what I was telling you about some of the points, that you have to like have a goal, inspiration and motivation, and then focus. So all of these, they tell you like examples so that it's etched in your mind. Okay, this is how it needs to go. That's how it is.
So does anyone else have any questions that they would like to ask her? And if you do, you can turn on your video and raise your hand, or you can click the raise hand button.
One more thing I want to say is, like, for example, if not everyone may not have all the questions ready right now, but after the thing, sometimes they listen and they have a question. Okay, I forgot to ask her this. So always please send if you have any questions regarding this, please send those to Nikhil Saigal, and then he can see, like, for example, same person three people may be asking the same question, and then he can cut it down to one question and then send it to me, and I'll be happy to answer them. And then see, like, if sometimes if you have any, like, for example, books, so I'll ask other people that who trained from here, like what books they read, and then how did they inspire and all that. So I'll get back to you guys, like, with some recommendations.
So if anyone has any questions later, you can email me at careertalk360@gmail.com. So make sure you guys email me and we can get back to you later if you have any questions. So anything else you would like to mention?
Me or the kids?
Oh, sorry. Is there anything else that you have for them that I didn't ask?
Okay, I think these are the main things. Like, be focused, and keep a goal. First of all, keep a goal, really work for it. And then nothing is a small job. Always think about it and be happy with your family too. And then try to accommodate. For example, like if you're really working hard and then at that time you don't have much time to the family, at least try to eat one meal with your family, be at least part. You don't have to like talk a lot or anything, be there, sit there, have a dinner with your family so that everybody is there. And then sometimes it's not bad. Like, for example, your mom can help you, your dad can help you, or your sister, brother, somebody can help you. Like, ask for help, like, and then you never know like how much like they will come out and then help you. Ask for help, finish up everything, stay focused, and then achieve your goal. And then I would always like my best wishes, and also like wishing you all the best in your future endeavors, whatever you may choose. Always be happy. And once you're happy, any big job also it's kind of like very small. Like, it's like you happily will do it. Sometimes people, like, I know some families where parents, like, they push you to do something or the other. So don't completely like back off, like, and then fire on them or something. Sit with them, talk with them. That's what I would say. Like, even my kids, like, they sit down, talk and reason with us, and then we'll say, okay, we'll go this way. So try to do that whatever you can, and then seek the counseling from your, like, counselors from school or college, and always be focused. Don't think, okay, I don't need a counselor right now, I have my thing all figured out. No, it's not. So I think there is a question about age perspective from somebody.
Yes, the question is, can I know from age perspective when you start fellowship or residency, and when do you become a doctor, and when do you start earning? That was what the question was.
Yes, it depends. Like, for example, we are talking about here, so 18 years you finish your high school, 18 or 19, I would say. Some people may lose a year here or there. And then after that, you have the 4 years of undergrad for pre-med school, like that's a 4 years. So which is kind of like you're already by the time 21, 22. And MCAT, some people may get in first attempt and some people may need 2 or 3. So I would say like put 1 or 2 years over there. And residency is again 3 years. So around like 26 to 28, I would say you can earn, like if you are thinking of internal medicine or family practice or something like that. For example, if for every, even in the medical profession, different things have different times of time frames. For example, you do neurology, that's 4 years. For example, you do surgery, that's 5 years. So you get the ballpark, right? So how many years it's going to be plus. So after surgery, some people train in colorectal surgery, vascular surgery, or plastics, hand surgery. That's like 2 years extra. So if you are especially looking for surgical side, I would say like 30 to 32, like that. And then if it is medical profession, like maybe 26 to 28 years, that's when and then once you finish your residency, it's not like you do not get a job. It's easy, like because people know you in most of the times in the same faculty or same place where you do your residency, you'll be offered a job. Or like sometimes you can look, for example, you want to relocate where your parents are or family is or relatives are, you can go there, but you'll get a job. So that's medical profession. Just like on the medicine side, it's like 26 to 28 and 30 to 32 on the surgical side, especially when you go for super specialization.
And if anyone has any questions, they can also send it in the chat. And one more question that I have is, you mentioned how the education is a very long process. How do you stay motivated during that process to keep on?
It is, yeah, it is definitely hard sometimes. Like you go, like, because you're working so hard, it's really hard to like update yourself. But the thing is, you're always like, I have like prescribed to many journals and then like magazines, like medical magazines. So they send you magazines every week, or mostly it's a month, couple of times a month, like that. So like you have a book, like small, like a magazine, but you may not be interested in all of the topics. They may be like 10, 15 topics. Out of that, something interests you, like maybe like couple, 2 or 3. So always you read those kind of stuff and you keep yourself updated. So that's how it is, like magazines or like journals, call it them journals. So always keep yourself updated. And then one more thing is, in medical profession, whichever profession you are doing in the US, every 10 years, you have to take your boards. So you have to prepare for that for at least like 2 to 3 months, take the boards. It's a little bit stressful, like juggling with your life, your career, and then taking these boards, but they want to keep you updated and then make sure you're up to date with the stuff, and then you're not forgetful. Because I don't want like somebody like who is 80 years old and then she forgets her stuff, and then you don't want her to treat you, because unless she's completely abreast with the new knowledge, you don't want them to do that.
So 2 questions came in. One person asked, what was it like taking the MCAT?
Okay, I did not take the MCAT. So I took its MCET in India. So MCET was like, you have to start practicing after the 10th grade, from 11th grade, from 10th grade, after the 10th grade, from the summer, you have these books. So we read those books, and then there's this MCQs that use multiple choice questions. So you read them, and then you start from after the 10th grade, and then 11th grade you study, 12th grade you study, and then you take the exam. For here, the MCAT is after 4 years of your undergraduation, you take the MCAT, but you will do the same thing even here, like, because from the beginning you'll have your tests and everything, and then people start preparing from the first year of undergraduation for the MCAT. So it's kind of like you'll be prepared adequately. And just like how you took SAT and ACT exams, it's the same way, like you get the preparation quite ahead of your time. So it's not that difficult. So I hope you'll understand like how the time frame is, and then you'll do good with that.
And there was one more question that somebody asked. Krish Gandhi asked, how did you know which specification you wanted, like as a doctor? How did you find that out?
Yes, because like once you like in your undergraduation, like not during your medical school, you're exposed like you go and practice that with the patients, and then like you understand like some people like OBGYN delivering the babies, so that is one person, and then some person wants to become a surgeon or a cardiologist or different things like that. But I wanted to like be like in general like be keep the wide thing and then able to do everything like that.
So for you, was it a tough decision to choose, or did you already know before?
Kind of like a ballpark. I kind of knew I wanted to do internal medicine. Definitely, it's kind of like for me, like definitely I did not want to do the surgery because the surgery it takes long time and then lots of blood and all that. So I was kind of a little bit queasy in the beginning. Not only that, I kind of like okay, I did not want to do that. So internal medicine is like more subtle, and then you'll be like able to help all different things. So.
And I have one question, and I know you can't reveal too many details about the patients because of privacy, but is there any rare sicknesses that you've had to work with?
Yes, especially during our residency time, there were a lot of cases because it's in a university hospital. You get trained, you see a lot of rare cases, and then it's like a learning point. That's what like, and then for example, you are in a different posting. You're doing like under nephrology or something interesting case comes. So they used to present that like we have this morning grand rounds like from 7 to 8 o'clock in the morning. So they used to present this case. Okay, this patient came and then not everything is revealed. For example, a patient's name is like something like John Smith, JS. So that's what they say. Patient this age, like 40 years old, JS, came with this, and then we discuss about how to work it out with the patient, like how to diagnose it, how to treat it, and everything. So even if you are in a different posting and then working on a different professors, you used to all go and see those patients, ask permission. Since it's a university patient, university hospital, so people know that residents work there, and then they come and look at you, talk to you, ask different questions, and see the very rare cases too, I would say.
Is there any time that nowadays that when you have patients, is there any time where you feel like you're not prepared for something that you have to do? Is there any time you felt unprepared?
Yes, sometimes like if it is like even common things like we do like work up everything like, but still like sometimes the patient is like, okay, like see even like a simple rash, we do all rule out the things, and then it's the frustrating point is for the patient and the physician, nothing is, you're not able to find a reason. They are going to be some things like that. And ultimately like, okay, you do all everything, and ultimately if it's not treated, then proceeding, it's not underprepared, but you try everything over the like what you can possibly do, and then still you have to send it to a skin specialist or something like that.
And this is the last chance for anyone if they want to ask their questions or anything, because I have one final question. And my final question is, okay, wait, one question came in. How did you feel the first time you were treating a patient? That's a question from Krish Gandhi.
Okay, it felt very happy because the thing is like what happens, we were trained under the doctors. Like for example, like even you're doing your internship, you treat the patient, but your attending physician or somebody is going to be there, and they will guide you. Okay, do this one, this one, this one. So, but first time when there is nobody, they will be there beside you, but you treat everything, and then the professor says, "Good job, you did great." So it feels like really I achieved something and I made some difference in my one other person. That's how you feel. Very happy indeed.
And so my final question is, since you had like a long education, was there any time during your education where you felt like you were unmotivated and you felt like this wasn't for you? And if there was, how did you keep on wanting to work if you felt very unmotivated at any time?
Yeah, the first when I came to the US after my marriage, and then first couple of years was really difficult because not only it was like a culture block to us, like culture changes there, like language is different, weather is different, and you are coming to a new person. So it was kind of like really hard to motivate myself free. So I was kind of like, okay, I'll take it easy. And the first 2 years was really hard to get back to that reading that pace because you lost because I was reading, I was doing good, I was practicing in India. Suddenly you came here and everything has been put. You cannot even drive. You don't have a driver's license, and then you cannot drive. It's like kind of like very depressing, and then going down, and then ultimately you need to pick yourself up. So my husband was like very motivating, and then my dad was the point, like he said, okay, you can do it, you always did it, never you went back, so you can do it. That was the motivation point. So I always used to think about my dad and my brother and my husband, like they were the ones like I used to look up onto, and then okay, I need to pull myself out of this and then study for this and then do it. So I was able to do it. So that was my, I think, my sad point in my whole life. But I was getting adjusted and all that. So it all turned out okay.
So we're almost running out of time. So if nobody else has any questions, then we will wrap up. And is there anything else you would like to say?
Yeah, thank you for giving me this opportunity, Nikhil Saigal. And I also admire and then all the best wishes for your future endeavors too. It's nice idea, and then I can understand just being a 14-year-old, just not thinking about your goal. You are able to think about the other kids at the same age group and put that into not just like right now, it's the COVID time, everybody's at home, you could enjoy, watch movies, do something else. But you took that time out of your enjoyment and your daily life to create this platform where like you develop your website, and then that idea. And then I would also like really admire your parents who were supporting you all the way and able to do this. And best wishes for keeping this up. In any way I can help you or find some other people to talk, or any way admire, I will do my best, and best wishes for everything, and best of luck.
Thank you so much for those kind words, and thank you so much for everybody who attended this. And thank you, Dr. Vijaya, for sharing your experiences and career and giving all your advices to the students. It helps everyone learn and have more experience. So it would be awesome if everybody, if they could say thank you to her, if they want to turn on their video and say thank you, or they could just message thank you. So everyone, that's the end of this meeting, and thank you. And for the future, stay tuned, as we will have more meetings like this very often. So thank you, everybody.
Have a good day. Take care. Bye.